Many people wait until they have to see the dentist because of tooth pain. It doesn't matter how old you are, your oral health can affect the well-being of your entire body. We're with the Kucey Dental Group today to find out what's new in dentistry, plus to get some tips on how to keep our pearly whites nice and healthy. Let's get started. Dr. Elena, how has dentistry changed, say, over the last few decades?
Well, there's so many new things that we have available to help our patients. No longer is it the scary thing that we might remember from many years ago.
What are some of the new ways that we can have the smile that maybe we weren't born with, but that we always wanted? Like, I know, veneers or crowns.
Yes, those are certainly, they've been around for quite a while, but they are definitely choices that we now have. I think we've added to that we really need to have a very, very straight and healthy foundation. So adding things with some even invisible braces might help with making someone healthier before they consider doing some of those treatments. And just replacing teeth with better things. In the old days it was bridges. Now we talk about implants and putting teeth back and restoring them rather than adding other teeth to that damage. I think that's a much more conservative and long-lasting way to do these types of things. And of course, whitening. Everyone's favorite is, can I have whiter, more beautiful, bigger teeth? So there's things we can do not only to brighten the teeth, but to make them more visible. We can do things even to help with muscles to not show certain areas of our smile that might be not helpful to making it either healthier or attractive that we're worried about.
Your world of dentistry is expanding every day with new technology and interesting 3D technology now. Tell us a bit about that.
Oh my goodness, it's totally changed how we see. You know, the old days of holding up that little x-ray up on the light and trying to explain that to someone. Today we can create a model for someone that's three-dimensional, that shows us depth, shows us a lot of the supporting structures, particularly when you're thinking about doing something perhaps with implants or something surgically that might involve, you know, things that we need to understand so that you, the patient, is informed of your choices and what might come if you have certain problems. So we have added a lot of these abilities to our plate so that we can inform our patients and plan for a much more successful outcome.
So 3D's one. Is there anything changed up with x-rays or how we look at those or share those?
Well, we can certainly digitally send them between offices and consult with our colleagues. If we need to ask a question, we can very quickly receive them if we have a patient from out of town that suddenly needs some care. So it makes the process a lot easier to transfer files.
Anything else new with technology?
Oh my gosh, my favorite subject lately, because I've enjoyed it, is the digital impression. It's a way to remove the goop from that impression. You know, for people who are gaggers, for people who really dislike having impressions done of their teeth when they're having crowns, when they're having other dental work done, it is a far more pleasant way to do it. It's like a video game for the dentist. The patients are really finding it very easy. And then the portability of that, we can instantly send that information and do more with it and store it in a different way. So it's a wonderful new technology. Having a sweet tooth is not a good thing, particularly as we age, because our saliva flow will diminish, and so the chemistry inside your mouth really changes. So when you're eating a lot of sugar more frequently, maybe you have more time, you're retired, or just at work, your habit is to grab a bunch of quick little bites to eat throughout the day, and you aren't realizing that there's hidden acids and sugar. So things like pop, anything carbonated, anything with alcohol, anything that has fruit juices in it, all of the acidic fruits that are wonderful for our body are not so wonderful for our teeth. So my best advice is drink lots and lots of water, keep water at your desk, use water throughout the day, and see your dentist and take good care of your teeth.